When it comes to understanding your body and your sexual health, the most important thing is to approach every topic with clarity, confidence, and accurate information. Many people feel embarrassed asking questions about anal sex preparation, wet dreams, or issues like sweaty genitals, but these concerns are completely normal and deserve honest, medically sound explanations. Your body is constantly responding to hormones, environment, and sexual activity, and the more you know, the healthier and more comfortable you'll be. Let's begin with anal sex preparation, a topic people often misunderstand. Safe and comfortable anal play relies on preparation, communication, and patience. The anus doesn't naturally lubricate the way the vagina does, so lubrication becomes essential. Using a generous amount of a high-quality, water-based or silicone-based lubricant can prevent tearing and discomfort. Preparation may also include gentle dilation using small toys, relaxation techniques, and a slow build-up rather than rushing. Hygiene is another key part of preparation. Some people prefer a simple exterior wash before engaging in anal play, while others use a small, gentle rinse. The important point is not to overdo it. The rectum is sensitive, and harsh cleaning can cause irritation. Most of all, communication between partners helps ensure a safe, consensual experience with no pressure or pain. Next, wet dreams, something that affects many people, especially during adolescence, but can also occur well into adulthood. Wet dreams happen when the body releases sexual tension during sleep, often influenced by hormones or erotic dreams. They are not a sign of a medical problem, nor do they indicate lack of control. In fact, they're a normal part of the sexual response cycle. As hormones shift with age, wet dreams may become more or less frequent. It's simply your body's natural way of managing sexual arousal, and it doesn't require treatment unless accompanied by pain or other concerning symptoms. Now let's talk about sweaty genitals, another very common concern. The groin has many sweat glands, and because the area stays warm and moist, it's easy for sweat, odor, and irritation to develop. This is a natural part of body function, not a sign of poor hygiene. Wearing breathable cotton underwear, avoiding overly tight clothing, and washing regularly with mild, fragrance-free soap can help keep things comfortable. If irritation or rashes occur, it may be due to friction, moisture, fungal overgrowth, or even skin sensitivity. In those cases, keeping the area dry, using antifungal powders when appropriate, and avoiding harsh products can make a big difference. For people who exercise frequently or live in hot climates, showering after sweating and changing into dry clothes can help prevent discomfort. Understanding these topics empowers you to take control of your sexual health. When you remove shame and replace it with knowledge, you open the door to safer experiences, healthier habits, and more confidence in your body. Sexual health is not just about preventing disease. It's about understanding how your body works and learning how to care for it. Whether it's preparing safely for anal sex, recognizing that wet dreams are normal, or managing sweat in the genital area, remembering that these things are simply human experiences can reduce stress and help you make informed decisions. Open conversations, accurate information, and a willingness to learn are the tools that lead to better overall well-being. Anal sex requires proper lubrication, patience, and gradual preparation to ensure safety, comfort, and a positive experience. Many people underestimate how different the anus is compared to other parts of the body when it comes to sexual activity. Unlike the vagina, which has natural lubrication and is designed to expand, the anus is primarily built for controlling bowel movements and does not self-lubricate. This means the tissues can be more prone to friction, tearing, and discomfort if preparation is rushed or lubrication is insufficient. To make anal play comfortable, slow, and safe, the process should begin even before any penetration. Mentally preparing yourself and your partner, communicating boundaries, and discussing comfort levels set the foundation for a better experience. Relaxation is one of the most important steps because the anal sphincter is a ring of muscles that naturally tightens when a person feels anxious, tense, or rushed. Taking deep breaths, creating a calm environment, and moving slowly help those muscles loosen naturally, preventing pain. Lubrication is absolutely essential and should never be skipped or minimized because the anus doesn't produce its own lubrication. Using a high-quality water-based or silicone-based lubricant allows smoother motion and reduces the risk of micro-tears. Applying lube generously to both the opening and whatever is being used for penetration is crucial. This is not an area where less is more. Reapplying lube as needed throughout the experience helps maintain comfort, especially since friction can increase over time. Some people find that warming the lubricant in their hands first helps the body relax even more. Gradual preparation is often the difference between a painful experience and a comfortable one. Starting with clean, Lubricated fingers or very small toys helps the sphincter muscles adapt gently to stretching. Slowly increasing size over time gives the body a chance to adjust without strain. There's no universal timeline for this process. It varies widely from person to person. What matters most is not the speed, but the comfort and consent of everyone involved. If pain occurs, it's usually a sign to slow down or pause, not to push forward. Listening to the body will always lead to better results. Communication between partners is another essential part of preparation. Clear conversation about comfort levels, boundaries, and what feels good helps prevent misunderstandings. It also creates an environment where both people feel safe expressing what they need. Anal play should never involve pressure, hesitation, or ignoring discomfort. Checking in verbally or non-verbally ensures that both partners stay connected and aware of each other's experience. Hygiene is also part of preparation, but it should be handled gently. A simple shower and external wash are often enough for most people. Some may choose a small, gentle rinse with warm water, but anything excessive or overly forceful can irritate the sensitive tissues. Ultimately, proper lubrication, patience, and gradual preparation transform anal activity from something potentially uncomfortable into something safe, consensual, and enjoyable. Understanding the body's needs and respecting its limits lays the foundation for positive and healthy sexual experiences. Hygiene for anal play is important, but it must be handled with care because the tissues in and around the anus are extremely delicate and can become irritated very easily. Many people believe that anal sex requires intense cleaning or harsh methods, but in reality, the safest and healthiest approach is gentle, minimal preparation. The rectum naturally contains bacteria, and while it's normal to worry about cleanliness, excessive washing can cause more harm than good. The skin and mucosa in this area can become dry, inflamed, or even develop microtears if exposed to strong soaps, perfumes, or forceful water pressure. This is why a simple, calm, and gentle cleaning routine is often the best preparation. For most people, a regular shower before sexual activity is enough. Washing the external anal area with warm water and a mild, fragrance-free soap keeps the skin clean without stripping away its natural protective barrier. Harsh scrubbing or using antibacterial products can disrupt the sensitive balance of the skin and lead to irritation, itching, or burning. The goal is cleanliness, not sterilization, because the rectum can never be made completely bacteria-free. Trying to achieve that level of cleanliness can lead to unnecessary irritation or even injury. Some individuals prefer using a small, gentle rinse or enema before anal play, but even this should be done with moderation. A simple bulb enema filled with warm, not hot, water is usually enough, and it should never be forced deeply or squeezed aggressively. 1 or 2 gentle rinses are typically more than adequate, and more than that can wash away natural mucus that protects the lining of the rectum. Excessive rinsing can also upset the balance of the gut environment, leading to dryness, soreness, or loose stools afterward. The intention is not to clear the entire rectum, but simply to remove anything close to the opening that might cause discomfort. It's also important to understand the emotional side of hygiene concerns. Many people feel nervous or embarrassed about the possibility of mess during anal sex, and that anxiety can take away from the experience. But the truth is, the body functions as it does, and there is always a chance of minor residue. This is normal and nothing to be ashamed of. Approaching the situation with calmness and realistic expectations reduces stress and allows for a more relaxed experience. Partners who communicate openly and compassionately about hygiene build trust, which is essential for comfort and pleasure. Another key aspect of hygiene is post-play care. After anal activity, the tissues may be sensitive, so washing again with warm water and gentle soap helps maintain cleanliness and reduces the risk of irritation. Avoiding tight clothing afterward and letting the area breathe can prevent discomfort. If there is minor soreness, applying a thin layer of a soothing barrier ointment can help. Overall, hygiene for anal play is about balance, clean enough to feel comfortable but gentle enough to protect delicate skin and tissues. Minimal cleaning, warm water, mild soap, and patience are all that's needed to maintain both safety and comfort. Wet dreams are a completely natural part of the human sexual response, and they occur in people of many different ages, although they are most common during adolescence and early adulthood. A wet dream happens when the body releases sexual tension during sleep, usually through an involuntary ejaculation in the case of males, or through arousal and sometimes orgasm in the case of females. This process is controlled by hormones, not by conscious choice. which is why it often catches people by surprise. Many individuals feel embarrassed or confused when they first experience a wet dream, but it's important to understand that it is not a sign of a problem, weakness, or lack of control. Instead, it is simply the body's way of managing natural sexual energy and maintaining hormonal balance. During sleep, the brain can enter a phase where sexual thoughts or dream imagery trigger the body's arousal mechanisms. Hormones like testosterone, which naturally fluctuate throughout the day and night, can reach levels that stimulate spontaneous erections and ejaculation. This does not require physical stimulation. The body is capable of doing this entirely on its own. As people grow older and their hormone levels shift, the frequency of wet dreams often decreases, but they may still occur occasionally well into adulthood. The timing and frequency vary from person to person, and there is no normal number. Some may experience them regularly, while others may rarely or never have them. Both patterns are perfectly normal. One of the biggest misconceptions about wet dreams is that they signal something unhealthy or that they should be stopped. In reality, they are harmless and do not indicate any kind of medical issue. The body is constantly producing sperm, and releasing it periodically during sleep is one natural way to maintain that system. For individuals who are sexually active or who masturbate regularly, wet dreams may occur less often simply because the body already has other outlets for release. But again, this varies widely among individuals, and neither pattern is better or worse. Emotionally, wet dreams can sometimes cause confusion, especially in younger people who may not fully understand what is happening. Some may feel embarrassed by the physical evidence left behind, while others worry that they have done something wrong. Learning that wet dreams are involuntary and normal can help reduce anxiety and encourage healthier attitudes towards sexual development. Open conversations and access to accurate information are important so that individuals do not develop unnecessary shame or fear about their bodies. From a physical perspective, wet dreams rarely cause discomfort, but occasionally there may be mild swelling, sensitivity, or pelvic pressure afterward due to muscle contractions that occur during ejaculation. This is usually brief and not a cause for concern. If wet dreams are accompanied by pain, burning, or unusually frequent nighttime ejaculation that disrupts sleep, then talking to a healthcare provider may be helpful to rule out issues like infection or inflammation. But for the vast majority of people, wet dreams are simply a natural physiological event that requires no treatment at all. Understanding wet dreams as a routine part of sexual health helps normalize them and eases unnecessary worries. The more people realize that these experiences are common and harmless, the more comfortable they become with their own bodies and natural sexual development. Sweaty genitals are one of the most common body concerns, yet they often cause unnecessary embarrassment because people don't realize how normal this issue truly is. The groin contains a high concentration of sweat glands, especially apocrine glands, which are the same glands found in the armpits. These glands are designed to release sweat when the body becomes warm, stressed, or physically active. Because the genital area stays covered most of the time, moisture becomes trapped, creating a warm environment where sweat can accumulate quickly. This is not a sign of poor hygiene. It is simply how the body naturally regulates temperature. Everyone experiences groin sweat to some degree, and certain conditions such as hot weather, tight clothing, hormonal changes, or exercise can make it more noticeable. Understanding why this happens can help people manage it more effectively. Sweat itself is not harmful, but when it mixes with bacteria on the skin, it can create odor or irritation. The folds of the groin, particularly in males with testicles or individuals with larger thighs, tend to trap moisture, making them more prone to rubbing, redness, and even fungal infections like jock itch. For women, the labial folds can also trap heat and sweat, leading to similar issues. In all cases, the key is maintaining balance rather than trying to eliminate sweat entirely. The body needs sweat to cool down, so the goal isn't to prevent sweating, but to reduce buildup, irritation, and odor. One of the simplest and most effective ways to manage sweaty genitals is choosing breathable, loose-fitting clothing. Cotton underwear allows air to circulate better than synthetic fabrics, which tend to trap heat and moisture. For people who exercise frequently or live in hot climates, moisture-wicking fabrics can also help by drawing sweat away from the skin. Changing into clean, dry underwear after sweating heavily is another effective way to keep the area comfortable and prevent irritation. Clothing that is too tight, especially tight jeans or compressive underwear, can worsen sweating by reducing airflow and increasing friction. Hygiene also plays an important role, but it should be approached gently. Washing the genital area once or twice a day with warm water and mild, fragrance-free soap helps remove sweat and bacteria without irritating the skin. Strong fragrances, deodorant sprays, or harsh cleansers can actually worsen sweat by causing the skin to react, inflame, or dry out. When the skin becomes irritated, it can sweat even more in an attempt to protect itself. After washing, drying the groin thoroughly is essential because moisture trapped in folds can lead to fungal growth. Patting dry with a clean towel or even using a cool blow dryer on a low setting can help. For individuals who experience persistent irritation, redness, or itching due to sweating, using antifungal powders, talc-free body powders, or moisture control creams can help keep the area dry without clogging pores. These products can be especially helpful for athletes or people who sweat heavily during daily activities. If odor becomes an issue, it is usually related to bacteria rather than the sweat itself. Maintaining good hygiene, wearing breathable fabrics, and avoiding overly tight clothing often solve the problem. Ultimately, sweating in the genital area is a normal bodily response, not something to feel ashamed of. Understanding how sweat works and learning simple daily habits to manage moisture can significantly improve comfort, reduce irritation, and support overall genital health. Irritation or odor in the genital area is something almost everyone experiences at some point, and it is often misunderstood. Many people assume that any smell or discomfort means poor hygiene, but that is rarely the case. The genital region has its own natural scent because it contains sweat glands, oils, and moisture-producing tissues that support the body's protective functions. When moisture and heat combine in this area, even with excellent hygiene, it creates an environment where bacteria or fungi can grow, leading to odor or irritation. This does not make someone unclean. It simply reflects how the body naturally works. The skin in the groin is delicate, and things like sweating, friction from clothing, hormonal changes, or even everyday activities can affect its balance. One common cause of irritation is friction, especially in people who walk a lot, exercise frequently, or wear tight clothing. The inner thighs, groin folds, and scrotal or labial skin can rub together, resulting in redness, itching, or chafing. This irritation becomes more noticeable when sweat is present because moisture softens the skin and makes it more vulnerable. Over time, constant friction can break down the outer layers of the skin, causing soreness or a burning sensation. Wearing looser clothing, using moisture-wicking fabrics, or applying a thin layer of protective cream or powder can significantly reduce friction and help the skin recover. Moisture is another major contributor to genital irritation. Whether from sweat, natural secretions, or heat, moisture trapped in folds can lead to fungal overgrowth, commonly known as jock itch. This condition isn't caused by poor hygiene. It occurs because the fungus thrives in warm, damp environments. Symptoms include persistent itching, redness, and sometimes a ring-shaped rash. Keeping the area dry, changing underwear after sweating, and using talc-free antifungal powders can prevent and treat these issues. For people who struggle with recurring moisture, sleeping without underwear or choosing breathable cotton fabrics can improve airflow and reduce dampness. Odor in the genital region also has many causes, most of which are harmless. Sweat itself doesn't have a strong smell, but when mixed with bacteria on the skin, it can create an odor. This is a natural process and doesn't mean someone is unclean. Washing the area daily with warm water and mild, fragrance-free soap helps maintain balance without irritating the skin. Strong perfumes, deodorant sprays, or scented body washes can disrupt the skin's natural microbiome, leading to even stronger odors or increased irritation. Gentle care is far more effective than aggressive washing. Skin sensitivity is another factor that often goes unnoticed. The genital area is highly reactive to detergents, tight fabrics, shaving, and even hormonal shifts. Many people develop irritation simply from using harsh laundry soap or wearing synthetic underwear. Switching to fragrance-free detergents, avoiding fabric softeners, and choosing softer, breathable materials can make a significant difference. In many cases, irritation and odor improve simply by allowing the skin to breathe, reducing moisture buildup, and adopting gentle cleaning habits. Understanding that these issues are typically caused by natural processes, not poor hygiene, helps reduce embarrassment and encourages more effective self-care. When people learn to work with their body's natural functions rather than fight them, comfort and confidence increase dramatically. Open communication, body awareness, and evidence-based knowledge are the foundations of safe, comfortable, and fulfilling sexual experiences, no matter a person's age or background. When people feel empowered to talk honestly about their bodies and their boundaries, it drastically reduces misunderstandings, anxiety, and the risk of discomfort or injury. Many individuals grow up without open conversations about sexual health, which leads to confusion, shame, or uncertainty when intimate situations arise. By choosing to communicate clearly with partners and educate oneself, a person takes control of their sexual well-being rather than feeling controlled by fear. Silence or misinformation. Communication begins with understanding your own body. This means recognizing what feels comfortable, what causes discomfort, and what boundaries you want to maintain. When someone knows their own limits, they can express them confidently to a partner. This also helps in recognizing when the body is giving signals that something isn't right, such as pain, dryness, tension, or emotional discomfort. Instead of ignoring these sensations, which can lead to physical or emotional harm, body awareness encourages people to pause, adjust, or stop when necessary. Listening to your body is not a weakness. It is a profound form of self-care. A partner who listens and communicates with the same openness creates an environment where intimacy becomes safer and more enjoyable. When two people talk about what they expect, what they prefer, and what they're unsure about, they build trust. Trust is one of the most important elements of healthy sexual experiences. It allows both individuals to relax, knowing that their boundaries will be respected. This relaxation not only enhances emotional safety, but also affects the physical body. When someone feels calm and respected, muscles, including the pelvic and anal muscles, are more likely to relax, reducing the chance of pain. This is one of the strongest examples of how emotional health directly affects physical comfort. Evidence-based knowledge is equally essential. Myths and misunderstandings about sexual health are extremely common, and many people unknowingly follow harmful practices because they've been misinformed by friends, the internet, or cultural taboos. Learning from reliable medical sources helps replace fear with confidence. Knowledge about lubrication, preparation, anatomy, hygiene, and natural bodily functions ensures that decisions are based on facts rather than assumptions. When people understand how their bodies work, they are better prepared to prevent injury, manage expectations, and respond appropriately if something feels uncomfortable. Another important aspect of evidence-based knowledge is recognizing what is normal. Many people worry unnecessarily about issues like sweating, odor, wet dreams, or natural lubrication changes. Understanding that these experiences are common reduces shame and encourages healthier habits. Instead of over-cleaning, panicking, or hiding concerns, individuals are more likely to practice gentle, effective care when they know what to expect. Open communication, body awareness, and accurate knowledge also help in identifying when something is genuinely wrong. While most sexual health concerns are harmless, a few symptoms such as severe pain, persistent irritation, or unusual discharge may require medical attention. Knowing the difference allows people to seek help confidently and early, preventing small issues from becoming bigger problems. Ultimately, sexual well-being is not about perfection. It is about understanding, respect, and informed choices. When people communicate clearly, listen to their bodies, and rely on trustworthy information, they create a safer, more comfortable, and more respectful experience for themselves and their partners. As we come to the end of this discussion, remember that understanding your body is one of the most important steps you can take toward a healthier and more confident life. Topics like anal preparation, wet dreams, sweaty genitals, irritation, and communication are often surrounded by silence, embarrassment, or misinformation, but they shouldn't be. These are natural parts of human sexuality and everyday physiology, and learning about them openly allows you to make choices that support your comfort, your safety, and your well-being. When you approach your body with curiosity instead of shame, knowledge instead of fear, and communication instead of silence, you create an environment where intimacy becomes respectful, safe, and fulfilling. Every body is different, and that's exactly why awareness and honest conversations matter. The more you understand your own needs and boundaries, the better you can express them. The more you communicate with your partner, the more trust you build. And the more you rely on accurate, evidence-based information, the more confident and empowered you become in every aspect of sexual health. Nothing about these topics should make you feel embarrassed or alone. You deserve clarity, comfort, and the freedom to take care of yourself without judgment. Let this be a reminder that sexual health is not a taboo subject. It is a vital part of overall health. Honor your body, listen to its signals, and treat it with patience and respect. When you do that, you create a foundation for experiences that are safer, healthier, and more meaningful. Your body is not something to be ashamed of. It is something to be understood, supported, and cared for. And the more you learn, the stronger and more confident you become in navigating every aspect of your intimate life.